So let's just talk about copper-associated hepatopathy. So signalment, there are breed predilections. Labrador, Doberman, Dalmatian, Bedlington, King Charles Cavaliers have a report out there. And then Westies, although I haven't seen a Westie with copper-associated disease in a long time, but it's probably still out there. Probably going to hold out to be true. Dogs that are homozygous for the ATP7B mutation or have a mutation like the Bedlington did, the COMD, who tend to accumulate copper faster, are going to get toxic levels quicker than, say, somebody who is accumulating copper because they have an environmental exposure. So young to middle-aged dogs, I think the average age is around 7 or 8. There is an increase in females in Labradors, but that trend has not been seen in any other breed of dog. So one of the things about the liver, besides it being great at like upregulating survival pathways, is at a huge functional reserve. So by the time you see clinical signs in a chronic disorder like this, they're going to be pretty far progressed. So you really want to pick them up before they get sick, have any clinical signs, because that's when you're going to get the best chance of curing the dogs of their disorder. So asymptomatic with increased serum ALT is what you want. And they're going to have a progressive increase. The rate at which dogs progress is going to be different for each dog. So you just got to monitor them. And if it's persistent, even like in Griff, did not have that much of an elevation, but the AST starts to become involved, or maybe the ALP starts to become involved, you need to figure out what's going on. Also keep in mind that there are some dogs that have a genetic inability to make a lot of ALT. So if you're following the ALT to figure out what's going on in the dog, you will be fooled. I don't know how common that mutation is. You can test for that mutation, though, on the Embark panel test for that mutation as well as the ATP7B.